mean, when I say they, the CSO chapter, CSON Kaduna chapter was invited to a state meeting. They called us at headquarters, and I went and I attended the meeting, and the government was very glad that we were there and co-opted CSON into the CADANAP, you know, the committee. These are the kind of things that we have in place that we hope will ensure continuity and sustainability of what we have achieved under the PACFaH project.
Please, a round of applause.
Please, there's a question that is not answered, and it was asked by my chairman, so I really need to address it. And the question was, what glued us together? What made us succeed at working together? And I would say they're very basic and very simple. The first one is that the proposal was jointly written. Everybody sat around the table to look at issues and write the proposal. The second one was the work planning sessions were jointly done. So each partner knew what the other one was doing and how they come in. And the third one was that we also did joint advocacy, planned advocacy that moved us together. Before we got there, we all knew who will do what, and so we worked together in harmony, following these steps. Now, the last thing I want to say is that Hajia is very correct in what he's asking, because some people use population as a way to thwart the family planning efforts. At the rural level, what we should be looking at is saving the lives of women. We're looking at access, and we know that family planning saves the lives of women. So we preach, space the birth of your children, and so that you will live to see the children you have and raise them up. That's where you get the community to buy into. Once you say population, they are close to the discussion. So we're very careful in who we address. But when we're addressing government, we're talking about dividends of democracy. And when you have a fertility decline, it helps the government to achieve the dividends of democracy. Thank you very much.
Thank you. Please, a round of applause for all the panelists. They've done great. And with that, we've come to the end of this particular session. We'll enter the next one very soon. And okay, thank you so much. Immediately, the next session is coming up. So, panelists, thank you so much.
Please, let's appreciate the panel members and the moderator. Where is the photographer? Kindly take them for a memorial. Right now, we are going to go into the second section, and we're going to make it very quick because we already, expended a lot of time on the first panel. And I'm happy to be moderating this particular section because the people here are in my constituency and they're very familiar. I'm very familiar with their job. Please join me as we make welcome very quickly Right Honorable Mohammed Usman from the House of Representatives. Put your hands together for him. Honorable Mohammed Usman, if you're here, please. All right, as we expect Honorable Mohammed, let us have Right Honorable Chike Okafor as representatives. And let us also have Honorable Silas Okolola. He's the Chairman, House Committee on Health, Oyo State. Please. Right Honorable Silas, are you here? Please put your hands together for him. Let us also welcome Right Honorable Bolanle Agbaje, the Chairperson, House Committee on Appropriation from Oyo State. Okay, the representative, Mr. Shegu, kindly come forward, please. Please put your hands together for him. Let us also welcome Honorable Ibrahim Katagom. He's the Chairman, House Committee on Health, Bauchi State. Bauchi has been on the news since morning, so let's put our hands together for this young man. We also are going to have in this very wonderful panel Right Honorable Mohammed Okbede, who is the Chairman, House Committee on Health, Nasarawa State. Put your hands together for him. Okay. Let us also have Right Honorable Olusegun Ajanaku from Oyo State House of Assembly. Are you here already? Okay, please take your seat. And then let us have, if you're here, sir, Honorable Dr. Isaac Zankai, Chairman, House Committee on Health, Kaduna State House of Assembly. Are you here? Please, if you're here, kindly come forward. Okay, I think that we have a very wonderful panel already. So we are going to be discussing the role of the legislature in guaranteeing the universal, health coverage. As we all know that the basic functions of the legislature include representation, lawmaking, appropriation, oversighting, constituency services, as we now have in literature. So I'm going to give us just two minutes to introduce ourselves and share your thoughts about this particular topic. So I start from you, Honorable Sir. The mic, please.
Okay. Good afternoon once again. I'm Honorable Kunlola Silas, the Chairman of the Committee on Health of your State House of Assembly. One, the role of legislator is just the same anywhere, anytime, which you have just summarized just now. The universal health coverage is possible. I want us to believe that it's possible with the step and the experience in the last 2 years, the way the health is improving in our areas. Health reform is improving things on what the last panelist said. I see sense and much in it. That is, when we work together, things move faster. As a legislator, I believe the universal health coverage is possible for now. For my
Thank you very
Thank
much.
you.
Please, the next panelist.
Thank you very much. My name is Olusegun Ajanaku, a member in the Oyo State House of Assembly. I'm here to represent the Chairman Appropriation Committee on the subject matter. I will quickly retreat on 4 specific areas as legislators are concerned, and citing our own case, Oyo State, as a case study. One, in terms of relationship, I think in the recent times, particularly about 2 years ago, we have a kind of robust relationship with the Ministry of Health, with the agencies that are advocating for UHC in the state. And this as a result of a kind of interaction that we have been having in the recent time, and it has really helped us in terms of enlightenment, in terms of education, and in terms of our activity in the House of Assembly. Then as regards legislation, for the past 2 years, I can boldly say there is no health-related bill in the House of Oyo State House of Assembly that we have not attended to. So we are giving this bill a kind of accelerated attention because of the new enlightenment and advocacy. That's part of our contribution to it. Then in terms of appropriation and funding, in the last budget, Dr. Abaniga is here to support my view. The budget that was brought to the House of Assembly, we did not even reduce a kobo from it. So all the money, the proposal for the health sector was given approval. That's kind of our support.
Excellent.
Then in terms of serving as our own relationship with the people, we are serving as agents of the Ministry of Health and the agencies as well. You know, the words that somebody made mention of the other time, we relate with our people at the grassroots. So all the programs of the government, as far as matters are concerned, we try as much as possible to educate our people. Recently, in the health insurance scheme, we are doing a lot as regard and other matters as well. So
we have serious questions, so just hold your thought.
Let's
welcome Honorable Saleh Nabayi of Bauchi State House of Assembly to join the panel while we hear from the next panelist. Honorable Saleh, you already seated? Okay, so go ahead.
Thank you very much. Bismillahir Rahmanir Rahim. First and foremost, my names are Honorable Saleh Nabayi, standing in as the chairman, Honorable Ibrahim Katagum. First and foremost, I will love to see Dr. Magashi because I have an addendum to his question in respect to Bauchi State. Apart from catching the governors as soon as they've been inaugurated, I think there is serious need for CBOs, CSOs to catch legislators also, because he himself, he know the level how, especially the Health Committee from Bauchi State House of Assembly, went far in lobbying His Excellency the Governor in terms of fund release. Therefore, catching legislators too is of paramount. Secondly, as my senior colleagues explained, as per the roles of legislators in achieving the UC universal health coverage, I believe we have separation of power, which mandated the members of the parliament to stay action upon their jurisdiction. Even in the Constitution, as amended in 1999, it mentioned legislators first before executive. By this, we all believe that legislators have a greater role in achieving all aspects of life in governance. Like in my state, Bauchi, when His Excellency the Governor presented a draft of 2016 budget, while going through the budget, we saw he earmarked 16%. He even go beyond Abuja declaration. When we put our head together, we look all nooks and crannies of our constituencies, being the representatives. We see reason why he captured 16%, and we quickly appropriate and approve the earmark fund for health sector. If not because of the cordial relation with the civil society organization, we could not even have foreknowledge upon the importance of health sector in our constituents. So, secondly, we have very important role, which called oversight.
Okay, all right, Honorable, we'll come to that very important role.
Okay.
All right, so let's just welcome the representative of distinguished Senator Mawo Ohuabunwa, who is the Senate Committee Chairman on Primary Health Care and Communicable Diseases, Mr. Uche Okoli. Put our hands together for him as he joins the panel. Okay, so let's have you, Honorable, to share your thoughts.
Good afternoon, gentlemen and ladies. I am Honorable Mohamed Okwede, representing Domanot in Nasarawa State, Chairman House Committee on Health. Like my colleagues have said, our own roles are simple, but delicate. Some of our executives look at us as a clearing house only. When you come back to check them, they look at you as an EFCC who come to look for what they have spent. We want to tell you in Nasarawa State, to achieve this program, my committee have agreed to have a quarterly check-in. in the Ministry of Health to see what is released and how it was used and how they benefit to our people, so that to enable us check our governor to tell him to be unfit to meet the expectation. So by grace of God, we are assuring this coalition that the program on ground, we are going to assist the program and make sure the program achieved. The last thing I want to say is to tell the partners, whatever program we are going to hold in the state, we should be unknown. We should be picture of all the programs we are going to hold in the state. Because some of the programs, the partners are going to the state, do their programs and left without House of Assembly knowing. So we wouldn't know what you have done and what do we need to add. So it's our advice. Thank you.
Okay, thank you very much. Now, Senator Mao, we are just sharing experience as to the possibility or otherwise of the role of the legislature in the universal health coverage. Just 2 minutes experience of what you think as to how possible or otherwise it is for us to achieve this.
Hello. First of all, my sincere apologies. I had to go I had to dash off to another function where I had to represent the senator. By the way, he's out of the country. He's a part of the ECOWAS parliament, and they are carrying out legislative functions there in Lome, Togo. The question is straight. We all know the role of legislators. It's about making legislations for things to work. And we're just sharing the thought earlier. Nothing works if you don't carry people along. If the legislators are not part of policy formulation at the very base, even the carrying out oversight functions will not be effective. There is that need for synergy between policy formulators and the legislators, because nothing works without the appropriate legislative framework, and that's where that comes in. Universal health coverage, which we are talking about today, you need legislative framework for that to happen. You cannot have universal health coverage if we don't increase funding in the health sector. How is that done? Through budgetary means. And you don't get that done without the support of the legislator. I think the role of legislators are very pivotal to achieving universal health coverage. And the earlier we strengthen that synergy and make it more effective, the better for us towards the realization of the universal health coverage. Thank you.
Okay, thank you very much. I'll just quickly, audience, if you're with me, say, together we win. I can't hear you. All right, thank you. So I'll just move straight to Honorable Silas. I'm going to ask you 3 specific questions, and then in just 5 minutes, you give me very short, precise, practical answers, because you know that you are policy makers. So we have the players, right? So we want to hear more from them so that you can take feedback you will factor into legislation. So the first question is, what has been the involvement of your assembly in financing the health sector in the last 3, 2, or 4 years, all right? And then what are the challenges you face in trying to provide for the universal health coverage in your state specifically? And then what next steps do you think should be taken to strengthen the position of the legislature in your state to ensure that we attain the universal health coverage?
Thank you once again. Let me start from the first. Yes. That is our involvement.
Yes.
Thank God the witnesses are numerous in this house. The Oyo State House of Assembly have been doing wonderfully well in the aspect of involvement in making the policy work. And how do we go about it? Just firstly, let others see the vision the way you see it. By the time every other member of the committee can catch the same fire, it is easier to go far. And that is exactly what happened. My senior leaders sat beside me, which is representing the appropriation, is member of my committee. And by the time we are deliberating, you will know who is who. We all do it together. And it helps us a lot. I'm just fresh in the house. Just around 2 years now. He has experience. And when we are meeting, he will not talk authoritatively, but he will say as if he is tender his own idea. This helps us a lot, and it helps us to dialogue in the area of executive after we might have played our own role as a legislator by appropriate the budget for the health sector.
Do you face any specific challenge in trying to provide funds for healthcare?
No. That one is very, very sure. It's tug of war.
Okay.
We'll drag a lot of things together. You know, everybody will be looking for a way to have more to his own side. But one thing is that the earlier you start, your lobbying will help the situation. Lobby should not be removed. As of assembly, you lobby others to know the reason why they should apportion more for that area. And it helps us, even the release. Time to time, we'll go about. This also works a lot in Oyo State, and it helps a lot. More especially the area of family planning. Personally, I don't believe much in family planning in time past, but they were able to convince me. After convincing me, I'm able to convince my people. And today, fortunately, just Tuesday, I'm making champion in the area of family planning. The extent I work faster, that is Nuri. They gave me the award of Tuesday because of the how far. Since they were able to convince me, I can go extra mile to make sure things work as far as Oyo State is concerned.
Excellent. What next step should Oyo State Assembly take now to ensure that we make progress? You know, it can get better from where you are.
No. Yes.
Okay.
Surely.
So in just one sentence, what should that next step be?
The next step is carrying order to take it. That's let me say, maybe the challenges I gave my people then, that Nuri, I told them that you said Nigeria urban reproductive. What of the rural areas? Only urban cannot help us. The members are representing different constituency. The members should take the vision back home. And that is what we are advocating presently in House of Assembly of Oyo State. We are organizing, each honorable are organizing town hall meeting, which will tell them you should carry along experts to talk to people about this project.
Please, let's put our hands together for Honorable Silas. Let me now have Honorable Olusegun to share his brief thought. You are both from the same state. Just, what didn't Honorable Silas add based on your experience? Because I'm not going to have you answer all the questions because of time. Just what do you need to add since both of you lobby?
Thanks very much. The first question you asked about our involvement, which I've already said in the budgetary allocation, performance in the term of the bills that we have passed into law that will be in support of the program that will help in achieving the UAC goals. Then in terms of challenges, I think in the aspect of funding, we are having serious challenge. You know, in most states of the federation, there's this paucity of fund. So it's one thing for you to appropriate money. It's another thing for the agency, for the ministry to be able to access the money. So that's a big problem. Even if you lobby the governor or the executive arm of government, they tell you, even your home money, have you got your money? So there's little we can do about that, but we are believing that things are improving. So the aspect of funding is a serious challenge. Then what next step? In the area of our oversight function, I believe we still need to do more. As far as I'm concerned, we are still slacking in that particular area. And we noticed it, and before our research, we said immediately we resume from the research, we go on oversight function. And that will also help in the area of accountability, because if you appropriate money, we should ordinarily know how much have they access of that particular money, what have they used them for. So this we have not done effectively, and it's in our program to do as soon as we resume. Thank you.
Thank you very much. Please, let's put our hands together for the panelists. Let's now move over to the Bauchi State House of Assembly. Honorable Saleh, kindly share your thoughts on those questions, your involvement, your challenges, and the next step you must take to advance the issue of the universal health coverage.
Once again, thank you very much. Not because I'm a legislator, we have separation of power, as earlier said, but the governor of Bauchi, being a barrister, he have a good listening ear, thereby allowing even the legislators to share experiences with him. Through that, as rightly said by Honorable from Oyo State House of Assembly, we have a slogans lobbying system. Through that, we have achieved a lot by telling him the importance of releasing funds to health sector. We have achieved that. And secondly, as mandated by our standing orders and the constitution of our federation, we have something called executive session before going to plenary. And that executive session is being held at the speaker's office. And any member that opportune to attend that particular session must report back so far what is happening in his constituency, including that of health sector. And there and then we decide upon the next step. And when suggestions were resolved, the session will mandate the House Committee to take charge on the particular issues being raised by any of the honorable member. And through that, we have achieved a lot. And so also, after this National Health Dialogue, I promise this gathering that when you go back to our assembly, I will equally transmit these experiences that we discuss here so that it will help a long way in giving any of the member a chance to give his quota toward actualizing universal
I think this
coverage.
Deserves an applause. All right, thank you, Honorable. Let's now go to the National State House of Assembly. Honorable sir, kindly share your thoughts on these questions.
Once again, it's like I have answered my question before, but I will repeat it.
Okay, can you now tell us what challenges?
Our involvement from the beginning is the budgeting. We involve ourselves during the budget to make sure that the budget is passed as is expected. And the constraint we are having, like I said before, after clearing this budget as a clearing house, the ministries will look at us as a EFCC coming to check them. They don't want to open up for us to check. Sometimes we have problem in the activities, what they are doing. But like I say, the solution I wanted to take a step to hold now is to have a quarterly checking of the ministry. They will come and explain what they have assessed so far and what they have done for me to know the next quarter, what are we expecting. And what by the third quarter, I will be able to know whether we are going to access all the funds budgeted for or not. Then we'll tackle it on head-on.
Thank you very much. Now, Mr. Uche, I know you are in the National Assembly, and Senator Mawo has been known to be a very vibrant advocate of the health sector, and he has sponsored a number of bills to promote universal health coverage. In fact, I'm aware that recently Project Pink Blue inducted him as a cancer fighting advocate. So I would like you to share just brief thoughts about the challenges the senator faces in trying to push the boundaries for Nigeria to have a good healthcare system, and what you think his next step will be in making this happen.
Yeah, thank you very much. Senator Mao Harbinwa is the chairman Senate Committee on Primary Health Care and Communicable Diseases. The 8th Assembly, the leadership in its wisdom, decided for the 4th time to have a committee mandated solely for primary health care and communicable diseases. Before now, it's all lumped in the health committee. But because the Senate sees primary health care as very fundamental, same goes with the communicable diseases. We all know about 70–80% of our health issues basically are the primary healthcare at the primary healthcare stage. I did remember the Honorable Minister for Health, while he was giving his speech, he did mention that we need to get 80% of our people using the primary health centers. When that is done, then we are on the path towards getting that done. So with the committee that my boss chairs, in this 2017 budget especially, there was a deliberate effort towards increasing the budgetary allocation of the agencies under the committee. And these agencies are at the core of primary health, which, like I did mention, the primary health care is what will help us achieve the universal health coverage. If we get that done, then we are home and dry. MPHCDA for the first time had a major leap in their allocation. Same goes for NACA, thank God the DG is here, and also for the Center for Disease Control. We talked about bills being pushed by the senator. He sponsored a bill on cancer treatment and a bill, National Center for Cancer Treatment and Research to be set up. The bill set to achieve one sole thing. I'm aware there's basically, I think, apart from UCH, there's no other tertiary institution that has a better facility to manage cancer patients. I stand corrected. But, till date, there is no national effort at cancer treatment. What the Treatment and Research Center tends to achieve is to be able to develop capacity towards not just the treatment, but the research. Also, the bill that should give legislative backing for Center for Disease Control is receiving attention, and the committee is determined to get that in place. And we know what it is. When we're able to control our diseases, it brings down the incidence of spread. But most importantly, legislative work is what we need to do, and then put effort towards making sure that during oversight, when budgetary allocations are made, the implementing agencies do what they're expected to do as far as implementation. Because if you do budget and there are no implementation, you've not achieved anything.
Thank you very much. So please put your hands together for Mr. Uche. We know that Senator Mao is the senator with the second most highest number of bills sponsored and assented to by the president in the 8th Assembly. So if I allow him, he will keep mentioning many more bills. So I appreciate them, please. Clap like we are health people now. Or do I call the DG Naka to check on? All right, thank you very much. Right now, we're going to take, I think that something that we need to take home is that there is commitment from the state assemblies and the National Assembly to drive the universal health coverage. And of course, the CSOs are also doing so much to make this happen. And the legislators have just told us that if you're a lawmaker without a lobbying skill, you are just like a handset without internet in today's world. So we all need the lobbying skill. Right now, I go over to the audience to just take, we have some questions that are going on online. We are taking just 2 questions because our next section is starting immediately. We're also encouraging you to go online and ask your questions, and then you also get responses. We have our team ready. So we won't take all the on-site questions here. So by the spirit, I'll just choose 2 people, and I'm a gender-friendly person. So I encourage women to raise their hands. Eh? Okay. So the lady there is number 1 and number 2. So we just have these 2. So let's start with the woman.
So I just wanted to appeal to all the different state representatives. When we are looking at health coverage, it's key to look at mental health. The NHIS scheme doesn't provide for mental health. So this is one of the things I want you all to take into account in your different states. Mental health is key, and we're having challenges in mental health that we never had in the past.
Okay, thank you.
Thank you very much.
Thank you very much. All right, come to number 2, sir.
Thank you very much. My name is Dr. Yahaya Nauzo. I'm from Niger State, the ED for primary health care. Thanks a lot, the panels. I know as you make these laws, you had mentioned that you depend a lot on lobbyists. So as they lobby, there's tendency to be passing a lot of bills. And some of these bills may be contradictory. For universal health care coverage to become a reality, I will want you and I urge you to make sure that there are no laws already that might be contradictory to the universal health coverage. If there are, to work hard to repeal them so that this bill that will support the universal coverage can move smoothly.
Thank you, sir.
Thank you.
Please, let's have Prof. in just 30 seconds. Prof, sir. You know, Prof, you know now. Please,
Thank
30 seconds.
Yeah, no, thank you very much. I felt if I don't speak, then I wouldn't have come here as the president of the Society of Gynecologists of Nigeria. Sir, universal health coverage is covered by the National Health Act. There are similar things that had come on in the past. The National Health Insurance failed, I can tell you that. The midwife services schemes failed. Why did they fail? They failed because it provided for 20% of the funds from the states to enable a state come into the scheme. The states refused to contribute. So the National Health Insurance Scheme, which was initiated in 1995, up till this moment was having only 5% coverage. The midwife services scheme, for which Nigeria won a best practice prize, failed. Now, we are talking of legislators and we are talking of the executive. And we talked about synergy. The synergy that has been talked about is very important. The states are achieving synergy. But is there a synergy between the federal and the states? Let me tell you why I'm asking this. Health is in the concurrent legislative list. That means the states are not under obligation to carry out what has been passed at the national level. This is why the states refuse to pay counterpart contribution to enable MSS to succeed. This is why they refuse to pay counterpart contribution to enable NHIS contribute. Are they going to pay counterpart contribution to enable the National Health Act succeed? No, they will not.
Prof,
unless
we have
there's
agreement.
a way. Unless there's a way, the federal legislature come to marry with the state legislators, they combine together and make good, well-intended bills passed at the national level to filter down to be implemented at the level of the state. If that is not done, then there's a problem.
Sir. Please put your hands together for Prof. I also learned that we are joined by the Honorable Commissioner of Health, Niger State, Dr. Mustafa Jibril. Please appreciate him. Now, we are not, because of time, because the DG Naka is here and he is going to be the lead discussant in the next panel. I would just want one person to respond to the question that has been asked, particularly as it relates to the legislature. Then I bring in our NHIS specialist to answer on the mental health question issue in just 1 minute. So in doing this, you will just let me know, amongst all the things that we have discussed today, which is most important to you, particularly the states. So go ahead, sir.
Thank you very much. Let me begin by a question raised by the female lady there on mental health. In the last quarter of 2016, as the House Committee on Health, we embarked on oversight. While oversighting the whole 27 general hospitals in our state, we realized that in all health conditions, mental health has been abandoned, so to say, or is being neglected. In our recommendation, while we came back to the Assembly, we spell out categorically to His Excellency, the Governor of Bauchi, considering the fact that we have Professor Abd Ibrahim. Anybody knows him from Bauchi. He retired but not tired, yet he is in service. We give our recommendation that let the state government under Ministry of Health to give a particular priority to those people that are suffering with mental retardation. And then, in the first quarter of 2017, the governor asked the Honorable Commissioner to please give him areas that need urgent attention by the government. And if you can go to Bauchi now, in all the general hospitals that are undergoing such services, you realize that yes, Bauchi State is eyeing those category of ill patients. Secondly, the prop, while saying there are concurrent lists of legislation and they are exclusive. Of course, yes. At the senior chamber, our National Assembly members, they are to deliberate and enact laws that have direct bearing on the exclusive list. When it goes down to the state assemblies, we don't have any alternative but to assist and domesticate that act. In this case, the National Assembly have enacted a law on National Health Insurance Scheme. When that law is being taken to Bauchi State, we quickly deliberated, argued, and agreed to domesticate Bauchi State Health Insurance Scheme. And when we have a dubious people along the line, not to say I will break my stomy, they quickly changed the content of the law we agreed to domesticate in our state. When that law goes to His Excellency, before he assented, he quickly called the Honorable Commissioner that please go through this bill and advise me. I'm coming, let me land, please. I want to assure him that not all the state assemblies that are ignoring the laws enacted by the National Assembly, but rather some states are abiding and allowing the laws to be enacted and domesticated in various states.
Thank you, Honorable Saleh. Please put your hands together. And in 30 seconds, my agreement is agreement. Just kindly respond to the health issue. the mental health question issue.